Okay, happy Wednesday, everyone. Thank you very much for tuning in. I have a very exciting guest on today. Um, his name is Brian David Earp. He's an ethicist and cognitive scientist at Oxford and Yale, and also a man of many other talents, actor, author, general all-around interesting chap. But today we have him on to talk about his recent book, which I recently barreled through, which is Love Drugs, in collaboration with Julian Savulescu, Professor Julian Savulescu. I should know that because he's kind of one of my supervisors. Um, and so Brian and Julian wrote this fascinating book about the possibilities, opportunities, pitfalls of using pharmaceuticals to alter our interpersonal relationships, in particular, our sense of love. Obviously, quite a hot, challenging topic, one that I think you raise a lot of controversies. Um, but despite the potentially sort of scary and out there sounding title, it hews very close, I think, to our current scientific understanding and what is scientifically possible. Julian as well has a background in medicine and neuroscience, so they're both coming at it from a very grounded perspective. And yeah, as someone who's interested in neuroethics and cognitive modulation through pharmaceuticals, electronics, etc., I thought it was a fascinating topic to talk about. So, yeah, welcome on, Brian. Thank you very much for coming.
Thanks for having me on your show.
So, Brian, if you haven't seen him before, he's got lots of great stuff. I'll link some of it later on, but in particular regarding this book, both Brian and Julian wrote a excellent Fox article. Could these drugs save your relationship? Which I'll just link in chat now. So if you just want the kind of overview of the book, it's there. It gives a great quick overview. However, if you find that interesting, I'd very much recommend um, reading the book itself. Now, um, to start, I'd like to kind of zoom out a bit and address practical ethics more generally. Um, so, I've over the last few years, in particular, I've become interested in the field, and I think one of the things I find most interesting and most compelling is the idea of using philosophy to very directly impact the world. And something that struck me with your book is that it was clearly written with a general audience in mind, not exclusively for a general audience. It's very academically useful, but it's also very readable. And yeah, I assume that was a deliberate choice. And why did you kind of choose to go in that direction?
Very much so. I'm that was the goal, and I'm pleased to hear that you felt it succeeded in some respect. Um, I have a general philosophy that if you have the privilege of being able to read and write and think about ideas all day long, that you have something of an obligation to try to express them in such a way that it's not just an inner conversation among some kind of priestly class of academics, and especially in the world of practical ethics. I think it's important to try to write in such a way that the public can be a part of the conversation. The stuff we talk about, drugs and drug policy and relationships and love, are things that most people will have some experience with or feelings about or perspective on. And Julian and I certainly don't feel that we have all the answers to what ethical frameworks we should adopt or which policies we should pursue. We have some ideas. We've been thinking about it for a while, and we hope we have something valuable to offer to the conversation. But partly what the book is about is trying to elicit a conversation with the public generally, lawmakers and policy people, but also anybody who might pick up the book and want to contribute their experiences or their thoughts or perspectives.
Cool. Well, I personally think that's a very valuable goal, particularly um, engaging with policymakers. You know, there's a lot of, incidentally, Brian is a very good Twitter follow and recently has been posting a bit about the importance of ethics in, or ethicists' input into the debate surrounding the war on drugs.
Hmm.
And
Yeah.
I think I think it's an area that philosophers have perhaps been reluctant to get into, or at least sort of ethicists of getting kind of down and dirty with the actual political wrangling that goes into making policy. Um, but my intuition, at least, is that that's a mistake. That we need, you know, voices of people who have seriously considered it, and as you could say, you know, have the privilege to be thinking and writing and sort of spending years pondering on these topics. It almost seems like a massive waste if they just, you know, talk amongst themselves with very inaccessible, complicated philosophical tomes and papers and so forth.
Yeah, and I think there often are normative premises built into popular discussions or policy writing. So, for example, the war on drugs, you'll have people talking about benefits and risks or public health outcomes or something like that. And it's supposed to sound neutral and scientific, but of course, if you talk about what's a benefit or what's a risk, there's going to be some values behind those declarations about what counts as a benefit or what counts as a risk, and whose welfare is at stake, and what are the alternative kinds of policies. So one reason why I think it's important for ethicists to get involved in this discussion, and right now I'm trying to work with actually a large swath of the bioethics community to put out a statement in support of legalizing recreational drugs. And we think there are moral reasons to do this and racial justice reasons to do this. The war on drugs has a very racist origins and is implemented in a racially discriminatory way, and is one of the main mechanisms by which large proportions of Black communities are funneled into the criminal justice system and disenfranchised by virtue of that, despite not using or selling drugs at a greater rate than other racial groups.
Mm.
And so, we can talk about public health type language. And it's true that the war on drugs worsens public health and makes uh, the kinds of concerns people have about, addiction and so forth. It makes those issues worse rather than betters them. But there are also moral considerations to raise, like what are the rights of a person to consume certain kinds of substances, and should that make them liable to, for example, criminal punishment? And those are philosophical, moral questions that also need to be talked about, not just the kind of scientific sounding benefits and risks language.
Yeah, I think that's an excellent point, and one that's very generally applicable to policy is that though we can empirically assess, or at least attempt to empirically assess the consequences, how we weigh those consequences, those benefits and risks, is entirely dependent on our normative judgments. Um, so yeah, I think that's, you know, very very laudable. Certainly, the war on drugs is a topic that I've found deeply concerning for a very long time now. That was my kind of actually my teenage introduction to libertarianism, which I've since kind of grown out of, but I've kept
Yeah,
the
that's so
hatred of
funny.
war on drugs.
Back in 2012, I wrote an article for the Practical Ethics blog called "Legalize Heroin," and it was when Ron Paul was running for president of the United States, and I was learning about libertarianism for the first time. And similarly, I had this sort of youthful enamoration with
Mm,
this general way of thinking. And it seemed kind of radical. It seemed that there was a sort of philosophical consistency to it that I wasn't seeing among
mm,
just the boilerplate Democratic platform or the Republican platform. It seemed like there was something consistent, something a little deeper about it.
yeah.
And with time, I've grown to think that there are many limitations to that worldview, and risks in implementing policy from a purely libertarian perspective. But one thing libertarians care about, and rightly so, is a certain vision of freedom. And what's happening now is people are realizing there are, I mean, lots of people have known this for a long time, but it's becoming part of the general consciousness. There are certain groups whose freedoms are unjustly constrained
Mm,
and limited, and taken away from them, often on the basis of kind of trumped up charges around drug use or drug possession or whatever. And so, if so, insofar as we care about freedom, we should care about the freedom of people, regardless of their skin color, to live their lives without being imprisoned unfairly. And so, the war on drugs is, the libertarians are right about that one.
mm,
They're right that the war on drugs is bad policy, that it's unjust, that it is immoral, and limits freedom in a way that can't be defended, and it does so disproportionately and harmfully to certain communities.
absolutely, yeah, and I think as many things as libertarianism it does get wrong, that's something that they really deserve a credit for being
Yeah.
so consistent over decades and decades. I
Mm-hmm.
had I had a researcher from the Adam Smith Institute on last week to discuss drug policy and some of the stuff they're doing, and I'm hopeful that we're kind of reaching towards a stage where we can have a where we can use public health policy over criminal justice policy, where we can,
Yeah.
you know, produce sensible regulations on these things rather than just blanket banning them. And this is something
Mm-hmm.
that you touched upon quite a lot in Love Drugs. Incidentally, 2011, the Ron Paul legalized heroin post just looked
Mm-hmm.
it up. So yeah, it goes back a while.
Oh, that's right.
Um,
Yeah, yeah.
uh, but yeah, I shall have a read of that later. And yeah, I
I think
think
it's
the
held up. I read it last week and I thought, oh, okay,
let's
I
have a
still
skin.
agree with this stuff. This is good. Okay, yeah,
Recreational cocaine. Okay, yeah, yeah. More drugs, dangerous deeds. Failed dramatically. Uh, yeah, I mean this is looking pretty solid. I do remember the excitement around Ron Paul. Uh,
yeah,
used to be on 4chan in the days. Not a good place, but
yeah,
yeah. Anyway, yeah. So the war on drugs is certainly something you touch on a bit in the book. Particularly with regards to drugs like LSD and MDMA in particular, which are increasingly showing the potential for therapeutic uses, but which are extremely difficult to do research on in no small part because of the massive red tape that one has to wade through in order to use these dangerous, no medical use, completely illegal drugs for
yeah.
for pharmaceutical studies.
Yeah, yeah, just a bit of history there.
Mm, please.
MDMA, which we focus on a bit in the book, as well as
Mm,
psilocybin, were being used in some communities primarily for therapeutic purposes, and with quite a lot of initial evidence that they were being very helpful. And then when MDMA leaked out and became associated with the rave party scene,
mm,
it triggered a conservative backlash, and there was a lot of really sloppy science done, where they would, for example, inject very high doses of MDMA into the brains of rats and to talk about all the neurotoxic effects that come from that, which weren't ecologically valid studies into the way that MDMA was being used in a therapeutic context. And so
mm,
there was a serious pushback from the scientific and therapeutic community at the time in the early 1980s when the Drug Enforcement Agency was proposing to list MDMA as well as psilocybin and LSD and all the psychedelic drugs as Schedule One substances. And they were saying the argument that these drugs have no therapeutic purpose is just false. We've been using them therapeutically and having, in many cases, huge effect size, obviously transformative effects for many people. And in terms of the harms that may be associated with these drugs, you can't conflate somebody who's dancing all night in a hot warehouse and not drinking water and taking MDMA with five other substances with controlled administration of these substances in therapeutic settings. And so the horror stories and these drugs are so harmful. They can indeed be harmful when they're used in inappropriate and irresponsible ways that aren't sufficiently well regulated or overseen. But when they're used in a controlled therapeutic setting, they are much less harmful than many drugs that are prescribed as medicine on a regular basis, and you know, uh, less harmful than alcohol in a sort of real world setting as well. So the trumped up charges against these drugs came out of bad science and reactionary politics in the
mm.
1980s, but it was never justified to list them as Schedule One substances.
Yeah, I completely agree, and I think one can make a similar case with things like, I mean, diacetyl morphine heroin is Schedule One in the US. No recognized medical use, and yet my mum had diacetyl morphine when I was born. She had a C-section, and uh, at the time in the Netherlands, that was the standard, uh, pain intervention, and indeed one could make some argument that having availability of diacetylmorphine in the US would have potentially lessened the opioid crisis by not providing a drive for um, novel opioids, synthetic opioids. Um, though that's a little bit kind of straying off the core now, but yeah, I think so. Uh, I guess we should probably back up a little bit
Sure.
when we're talking about, because we dived right in to the
Right.
interesting drug policy stuff. But um, I won't make the 80s song joke, but because you must hear it all the time. But what is love? You talk about the kind of psychosocial aspect and biological aspect. Um,
Mhm.
are these two like separate aspects of love? Are they inherently linked? How do those work? What are they?
We talk about love as basically a biopsychosocial phenomenon, which just means that there's a biological dimension or aspect that, without certain things going on in your brain, you certainly wouldn't be feeling subjectively what you feel when people write songs about love. And so you've got to, whatever else you want to talk about, if you want to talk about the phenomenological experience of love, and if you want to talk about how love is characterized in a social context, what are the kinds of things people say about love, what are the concepts that are employed to try to capture these subjective states, um, you're also going to have to give some attention to the underlying biology that allows those kinds of feelings to happen. And now that we have more information about how various chemical substances interact with that underlying neurochemistry and affect those subjective states and experiences that we talk about as love, it just seems that any robust understanding of the phenomenon will require that we understand as much as we can about not just the phenomenology and the psychological aspects, but also the social context, the social and historical and conceptual context of how we write and conceive about love, and also the biological underpinning. So we try to take a holistic approach to understanding what love is along all of those dimensions.
I think one way or one aspect of your description that worked particularly well for me was that you make it very explicit that um, you're not saying that by quantifying uh, love we are like reducing it to mere atoms, and similarly by focusing on the experiential value of it we're not negating the physical underpinnings of it. um,
Mm-hmm.
and yeah, it's a compelling explanation, one I think makes a lot of sense for trying to conceptualize a complex neurological and sort of social phenomenon. Um,
One reason why we do that, by the way, is just kind of a conservative argument, which is that we use lots of drugs for medicine, including selective serotonin reuptake
mm,
inhibitors, which is what we focus on a lot in the book. These are drugs that are very widely prescribed as antidepressant medications. And we have good theoretical reason and some preliminary empirical evidence to think that this drug is interacting on certainly the serotonin system, part of which is involved in our subjective feelings of romantic love and in our ability to form certain kinds of attachments and maintain certain kinds of attachments. And so it just is the case that we're already taking drugs that are affecting our romantic relationships and our subjective experiences of love differently for different people, depending on the dose that they're taking and what their circumstances are and the nature of their relationship with the other person. But love drugs are already being used,
mm.
and so we can just you know ignore that phenomenon and keep shooting in the dark and hope that when we take some sort of medication, it isn't going to mess up our relationship in a certain kind of a way. But that seems sort of foolish. We have a tendency in Western medicine to focus on the individual level symptoms of what we intend a drug to be doing. So we say, you've got depression, we've got a drug that we think will blunt the feelings of sadness that you're experiencing and hopefully allow you to get your life together. And so when I run a trial to look at the effects of these drugs, I'm only going to be recording outcomes that are relevant to what I think the drug is for. But a selective serotonin reuptake inhibitor is just that. It just selectively inhibits the reuptake of serotonin.
Mm.
And that does all sorts of stuff. It doesn't just blunt your emotions to do with sadness. It can also, in some cases, block feelings of care and concern for your partner. It can have side effects on libido. It can influence your subjective feelings of love for your partner. But unless you measure those things systematically, you won't even know to put them on the side of the bottle as a side effect. And so we just call, generally speaking, for a kind of relational turn in drug research and scientific research generally, where instead of looking only at the individual level symptomology of what we hope a drug will be treating, we should be looking at the interpersonal effects of drugs that we're already using, And then we talk about these new drugs that are coming back in to mainstream medicine uh, with the so-called psychedelic renaissance, and we're saying, these are powerful drugs. There's historical evidence to think that they can be helpful, and they were used as aids to couples counseling in the 1980s. And maybe we should look at positive uses of drugs for our relationships. But either way, we should be studying the interpersonal effects, not just the individual level outcomes.
So that whole line of argument really struck me because so my background's in neuroscience, and obviously I've read a fair number of papers detailing the effects of antidepressants and all kinds of psychoactive drugs. And yeah, thinking back over that research I've read, I struggled to think of a single instance where it was seriously quantifying, um, romantic feelings, attachment. You might get things like libido, or
Yeah.
a level of sexual arousal or something relatively kind of baseline, like physiological kind of, or one step up from the physiology sort of functions. But
Yeah.
um, yeah, it's just considering love and attachment and relationships are such a big part of human experience. It almost seems baffling that this isn't a more widespread consideration when quantifying side effects or quantifying generally the effects of a drug.
I think people are worried about quantifying anything in the realm of love because
Mm,
we're worried that it will demystify love, and we hold love in a special place in our cultural and literary kind of pantheon as being this phenomenon that's almost meant to be ineffable, and something that you can't articulate or even capture in words necessarily. And so then trying to go beyond that and try to capture it in numbers, I think, turns people off. So our point is just that love is a many splendored thing, and it can be described along many different dimensions. So if you look at the aspects of, say, interpersonal attachment that could be measured in some way, at least potentially, you could just measure things like straightforward elements of relationship quality.
mm.
When you take this drug under such and so conditions, do you find that you feel close to your partner or not? I mean, there's a big body of relationship science that tries to take account of the kinds of factors that lead people to feel that they're in a flourishing relationship. And so, you know, trying to understand the quantifiable aspects of our interpersonal connections so that we can avoid the worst harms that we might be exposing ourselves to by using certain technologies just seems like a prudent approach. And what we try to emphasize in the book is that by looking at that aspect of love, we're not denying the mystery and the magic and the wonderfulness of the experiential qualities of love, nor the many different ways that love can be characterized in terms of the concepts we use to try to communicate with each other about what it feels like to be in love with someone. So it's not either or. It's not once you start talking about science and numbers, you're somehow negating the magisterial feelings that you have when you're in love with someone. You can have both of them, or so we argue in the book.
Yeah, and I think so. That's obviously a theme that goes back through scientific writing for decades, centuries. Does it detract from the flower to understand the flow of fluid through its leaves, veins, and the reproductive cycle and so forth? And
Yeah.
I suppose it's one that you're probably not going to conclusively resolve in one book, but I think personally for me, I find it inspiring to know how things work and to have some vague grasp of the physical mechanisms that are underpinning these powerful feelings of subjective reality. Um, and
Let me
sorry,
just throw a quick thing in there. There's a
oh,
beautiful
go ahead.
passage by Richard Feynman, I think. I don't remember what
Yes,
what
I was
interview it's
just
from,
about to
but
bring this up.
yeah, well, he talks about how he's got a poet friend of his who says, we're looking at this flower, and I, as a poet, can appreciate the beauty of this flower, but you, as a scientist, you just tear it apart and break it down into its constituent components, and you can't fully appreciate the beauty of this flower. And Feynman says, well, listen, I'm no poet, but I think I can appreciate the beauty of a flower. I'm looking at it. It really affects me in a certain kind of way. But he says, by being also able to take a scientific lens to the flower, I can think about it at a microscopic level. I can think about the flower in terms of which properties it has that attract the attention of bees. And then I think to myself, well, perhaps bees then have an aesthetic sense and something like the way that I have an aesthetic sense. And what is it about bees and about me that allow us both to appreciate the beauty of this flower and to be attracted to it in a certain kind of a way? And whole new worlds open up, whereby not only can I appreciate the flower in something that approaches your poetic sense, but I can also unpack it at all these other levels and dimensions and so forth, which give me more to appreciate about the flower. And I think it's a very convincing argument, and I think it's true. And I think that can be true about love. Thinking about why did love evolve? In what way does our attraction to each other relate to the way that other animals form bonds and so forth in the animal kingdom? And is there some subjective thing that a prairie vole feels for its partner that's analogous in some way to what we feel for the people with whom we fall in love? And how does this relate to the nature of us as a sexually reproducing species? And there's all sorts of other interesting stuff you can now do instead of just appealing to platitudes about love is so wondrous and mysterious. It still is wondrous and mysterious, but now it's wondrous and mysterious along all these new dimensions that science can potentially allow you to begin to pay attention to.
Yeah, I mean, I couldn't agree more. I think Feynman puts it well, and so do you. Um, so we've kind of established that we can, in some sense, modulate love through biotechnology. Now, the book goes into several more examples, but if we can just point to MDMA or alcohol or oxytocin or anyone,
Mm-hmm.
we can see that we can, in some sense, um, uh, uh, modulate the effects. And so, why would we want to do that? What benefit to society might we gain from being able to enhance or reduce our sort of level of attachment?
Well, maybe a place to start is to talk about MDMA as it's being reintroduced into medicine as an uh, adjunct to psychotherapy for post-traumatic stress disorder. So some of the really promising results that are being published in recent years suggest that people who have experienced very serious traumas and they go to talk therapy to try to resolve them find that they can't even begin to get into the underlying concerns that are plaguing their minds because they have this hair trigger fear response where if you ask them about the thing that's causing the trauma, they just don't want to get into it. It's really as a protective, self-protective
Mm.
mechanism, it's buried pretty deep within their psyche and they don't want to address it. And that means that they never really fully deal with it or move through the trauma and kind of heal themselves from what they're dealing with. Instead, they often are taking all sorts of different drugs to paper over the symptoms, and they spend the rest of their life on dozens of medications just trying to get by. Whereas it would be better if they could, in a safe environment and with a trusting relationship established with the therapist, actually work through the difficulty. And what they're finding with MDMA is that under the right circumstances, it just directly suppresses that hair trigger fear response and allows people to, in a way that feels more safe and uh, with the emotions becoming more available, they can go into some of those memories and traumas and difficult issues and actually work through them, actually resolve the underlying problem. And so, if you think about relationships, I mean, first of all, some relationships just are traumatic in much the same way that clinically diagnosable PTSD may follow from something like an experience in a war zone. Some relationships are kind of like war zones, and we have traumas that we experience within our relationships, and so you can just directly apply the reasoning there. There's a lot of stuff when people go to a relationship counselor where they should be working through a certain thing, but they're dancing around it, or they're uh, getting into their knee-jerk defensive responses, or they slip into some pattern that they've been doing for 10 years in their marriage, where anytime something is brought up, they just respond in the same kind of way. And you can imagine that if they understand what this experience is going to be like, and they've developed a safe and trusting relationship with the therapist, and they agree that this is something that they want to do together, it might be that they can raise certain issues within the relationship that they ought to raise. And it doesn't necessarily mean they're just going to fall head over heels back in love with each other, although there are many case studies of something like that being the case from the 1980s when this sort of work was initially done. Sometimes they might realize that they really oughtn't to be together. Maybe they face up to something that they've been uh, ignoring or setting aside for many years, and they say, maybe it's better for us to end this relationship, but to do it from a place of love rather than from throwing grenades at each other as we walk out the door. And so that's the kind of big picture reason why you might think that the adjunctive use of a drug in a therapeutic context would put people into a state of mind whereby the normal point of therapy would simply be more accessible or would be enhanced in some way. So any reason why you might go to a couples counselor to try to work on your relationship, those very same reasons would be ones why you might want to try to enhance the effects of the couples counseling with the adjunctive use of a drug.
And I think you make the case, and I think I would certainly agree with you that there's not necessarily anything like fundamentally different in kind of moral character there than there is to say having a glass of wine with a pleasant dinner with your new prospective romantic partner in order to enhance the evening. Um, there's lots of scenarios in everyday life where we do use recreational drugs in order to enhance our experiences, um, and doing so
And
for a
they're
kind of
right.
therapeutic. Sorry, go ahead.
Um, no, I'm sorry to cut you off.
No, not
I'm
at all.
just agreeing with you, and to add to that, there are many things that we do to try to change our perspective from the normal day-to-day ruts that we fall into. So sometimes when people will say, "Well, you should go on a romantic vacation with your partner to rekindle your passion, or whatever," or you should go hiking in the mountains and look out over the valley and have this vast perspective on the smallness of whatever in the
Mm,
universe. There are things that we do. I mean, even seeing beautiful art or going to the theater or having a movie that really transforms your perspective on things. What it's doing is it's getting you out of your stimulus response rut that you can often get into, and it allows you to put things in a different perspective. So one way you can change your perspective is by climbing to the top of a mountain and looking out over a vast stretch of land and thinking about things in that from that point of view. And for the longest time, over millennia, different cultures have known that another thing you can do to change your perspective temporarily is to ingest certain kinds of chemical substances, which directly work on your neurons to elicit altered states of consciousness, whereby you can kind of look at your own emotions from a different perspective or look at your partner from a different perspective. And then, the effects of the drug wear off, and you have the memories of what it was like to think about things differently, and you can make an informed, reasoned decision about whether those insights were valid or whether they're the sorts of things you want to then bring into your normal waking consciousness. And that's the idea with these therapies, is that over the course of 3 or 4 hours, you're going to look at your emotions differently, your partner differently, but you're still there in the experience, and you're remembering what that felt like, and you can then decide whether there are valid insights from that experience that you then want to incorporate into your life. But we do things all the time to try to shake ourselves out of a rut or to
mm.
reset our perspective a little bit. And this is one tool we can use to do that under the right conditions.
Yeah, that kind of brings us on to the issue of authenticity, and
Yeah.
and it's one that the practical ethics group I think writes on quite a lot, and so we've got an article here by Jonathan Pugh, Hannah Maslin, and once again Julian Savulescu, that I was very lucky to contribute towards a bit. Deep brain stimulation, authenticity, and value, and also a article specifically on brainjacking that I wrote along with Jonathan Pugh again, who did the kind of heavy lifting, Anders Sandberg, and my
Mm-hmm.
supervisors Tipu Aziz and Julian Savulescu. And
Yeah.
Anders is a friend of the show, and he gets a very big name check in your book as well, because I'm
Yeah.
completely unsurprised. He's excellent on this kind of pharmacological modulation of cognition stuff. Um,
Yeah.
but yeah, so the authenticity issue I think is one that's very important. But as we pointed out in these two papers, it's not necessarily the case that taking a neurological intervention, and we were talking about deep brain stimulation, but the principle is pretty similar with drugs, though it does artificially impact your neural state. There's not necessarily a reason to believe that that's inherently less authentic than your state without the intervention, and in some cases could arguably increase the authenticity of one's experiences by impeding pathological states that are interfering with your uh, most authentic expression of yourself. And
It's not
yeah,
even clear in what sense it's artificial. So I mean, take
mm,
the case of, say, psilocybin from mushrooms. Mushrooms grow in the forest, and we have all sorts of foods that we consume, and the foods have different effects on us, some that are more or less pronounced. But if you want to try to draw a natural versus artificial distinction, some of these drugs are perfectly natural,
mm,
and they've been used in different social contexts for a long time to be part of the range of human experiences that we can have
mm,
subjectively. So there's the artificial natural distinction, which sometimes people make too much about, where they think if something is quote unquote artificial, then it's something that it deserves a certain kind of skepticism. And then the other thing is, as you say, is authenticity is somewhat orthogonal to the question of whether you have a drug altered state, because our normal our normal waking consciousness can be inauthentic in that if I've got defense mechanisms I've built up over the years or certain sort of strategies I've used to try to protect myself emotionally from pain of a relationship or whatever, it might be that I'm not authentically engaging with my own emotions under the ordinary circumstances, in which case it might be that if I take a drug that shakes loose some of those defense mechanisms and allows me to actually face up to some of my spontaneous emotional reactions, or ways I might feel where I'm not so defensive all the time, maybe that's more authentic. And so it's also true that you can have drug altered states that may be inauthentic, in that you find yourself less integrated in terms of your inner emotional life after the experience. And people who are prone to certain kinds of psychosis, for example, probably shouldn't take some of these drugs. And so there are risk factors that is part of what we call attention to the need to study. But whether something's authentic or not is something that is an evaluation you have to make both about your ordinary kind of emotional life and your drug altered emotional life, and either of those can be inauthentic.
Yeah, absolutely. Um, and so I've got a input from chat here. I think there's also the problem of drugs being seen as a quote cheat or a quote too easy a solution, which is part of the stigma and moralization around drugs. And I think um, that seems to me to be very true in both medicine and in kind of enhancement beyond medicine.
Mhm. Yeah, I think that is a concern, that people feel that if you have to consume a substance to try to deal with some issue, that there's a risk that it will just be a temporary kind of band-aid that prohibits you from making deeper and longer lasting changes. But that again depends on the drug and depends on the way in which it's used. So just take the example of selective serotonin reuptake inhibitors again. There are two main ways that people talk about the effects of these drugs. Some people will say that they're hurting, they feel depressed about such and so in their life, and it might be that's their emotional system telling them that something needs to change. Maybe they have a horrible job or they're in a bad relationship that they need to get out of. And so if you take a drug that just kind of settles down those emotional signals so that you find them easier to ignore and you can just kind of trudge through your day without really dealing with the deeper issues, then it is a crutch. You're using a drug
Mm,
to get by without actually dealing with the deeper issues, which would require a sustained engagement with your circumstances. Other people though will say, listen, I have the things that are important to me in terms of my relationships and my job and my situation, but I've got this unaccountable feeling of depression that's like a blanket weighing me down, that makes me feel like I can't access my emotions and that I'm not my true self. And for some people, if they're among the subset of people for whom SSRIs are effective treatments for depression, they might find that the drug lifts that blanket of depression and allows them to engage in their relationships and in their life and in their job in a more fruitful way. So, even with one and the same drug, depending on the person and how they respond to the drug and what's going on in their lives, you may well have it be serving a crutch-like role, or it may be that it allows you to actually get out of bed and go deal with the real problems in your life that you need to deal with, because you're able to at least function.
mm,
And I think the same thing can be true of these drugs. For some people, what they do is they're a tool that allows you to deeply engage with what's really going on in your life, so that then you actually have to make the important, long-lasting changes that you otherwise might ignore because you're too busy just going to work every day and coming home and getting stuck in your routine. So the general point here is a drug is a tool that can be used well or used poorly. It can be used in a crutch-like way depending on how you use it or what the outcome is, but it can potentially also facilitate deeper engagement with the quote-unquote real world underlying bigger picture issues.
mm. Yeah, I think very well put. Um, and I think that brings us on to the fact that increasingly there's perhaps not such a clear line between purely medical uses of drugs or other biological interventions and kind of recreational lifestyle uses. The the increasing medicalization of society is an issue that's often brought up as being this kind of terrifying, juggernaut that's going to make everything into a medical problem. Um, but I think Love Drugs had a considerably more interesting nuanced take on that problem.
Right. So we're concerned about the medicalization of society, and in particular, we're concerned about what we call pathologization. I mean, that's not our term; it comes up in this literature a lot. But basically, the problem is this: if we have a drug in society that we realize can help people in a certain way, we have to refer it up to our current model, which is that drugs are either medicine or they're what we call recreation.
Mm,
And I think that's also an unfortunate thing because a lot of people use drugs in ways that aren't just because they're having fun. They may use drugs in a way that's for spiritual enhancement or using
mm,
drugs in a way that actually has some sort of deep meaning for them. So I think we trivialize certain kinds of drug
mm.
use by referring to it as
Or
recreational.
conversely,
Uh,
there's sort of enhancement, students or
mhm,
researchers using it for cognitive performance, that kind of thing.
right. And so if we think a drug can be useful, we tend to have a response whereby we want to call it medicine. And if we call it medicine, that means we need to have it be treating something. And if it's treating something, that means there needs to be a disease or a disorder that we're treating. And
Mm,
so what you will get is an incentive for pharmaceutical companies and I don't know psychiatrists who are coming up with criteria for the DSM to say, well, we better go figure out what the disease is that this drug is treating. And so then you might imagine coming up with relationship disorders or something. You know, you have commitment phobia, and they're going to put that in the DSM as a real quote unquote disorder that can be treated with a drug. And so what we say is instead of pathologizing more areas of human life through medicalizing relationships, perhaps we should demedicalize certain drugs.
mm.
We should adopt a different model, which we talk about as an enhancement model or a sort of welfare promotion model, which is we should find a way in society to make certain kinds of technologies that we now think of as medical technologies available to people insofar as they would genuinely improve the person's life. So not be used as a crutch or some kind of half measure. If the thing will really genuinely promote the person's flourishing, then we should be able to find a way that people can access that experience without first having to come up with some sort of disease label that we apply to them. And that's because we do think pathologization is a problem and something we should be on guard for.
Yeah, it just occurs to me that one area that does seem to manage to do this is in sport. Lots of top tier athletes have access to whole teams of biomedical professionals who aren't treating them as suffering from a pathology, but are nonetheless applying a very large amount of biotechnology to kind of enhancing their performance within the boundaries of the regulations of the sport. Um,
Another example where this is getting some traction in recent years has to do with so-called gender-affirming interventions.
mm,
Sometimes they're hormonal, sometimes they're surgical. But there's a concern among people in the transgender community that having, as they would say, having a transgender identity isn't a disease state, it isn't a pathology. And yet, nevertheless, they say it sure would be helpful for me to live in my body in a way that allows me to flourish in my relationships and in my communities, to have access to certain kinds of drugs and potentially even certain kinds of surgeries. And I think there's a reason to think that you may be able to have your cake and eat it too. It might well be that we in this area there's moves to try to say without pathologizing the individual, we can just recognize that access to these technologies will be essential for their welfare. And then this is an area now where this kind of welfarist model of enhancement is gaining traction among a wider group of people, not just the sort of transhumanists or futurists or whoever are usually making these arguments.
So yeah, as someone who's a used to be libertarian and is still very transhumanist, I've been very much on board with this for some time. But it's
Yeah.
it's pleasing to see that this is being kind of more widely considered as a serious model, because I think it's shutting ourselves off to a lot of very wonderful technology and introducing concerning incentive structures if we do continue to rely on a DSM definition being the only cause that you can be given
Right.
certain drugs.
Yeah.
And sorry, I'm just dealing with my own little bit of biotechnology right now. My my glucose sensor is just requiring a new battery, or
All right. Sure.
specifically the relay between my sensor and the phone. So,
Yeah,
sorry, just sorting that out
I'll
quickly.
go deal with some biotechnology by grabbing myself some coffee then.
Cool, sensible,
That's
yeah.
the biotechnology that I need right now.
Have you got a prescription for that?
Yeah, yeah, exactly.
Right, okay. Right, while we have a little bio break and figure out our respective technologies, I would like to thank everyone for watching. I hope everyone is having a good time and finding this interesting. Ah, you're back. Uh, cool. Right,
Hmm.
just resetting my well, it's not exactly my extended mind, but my extended um, homeostasis.
Right.
I very much enjoy Chalmers' extended mind sort of thesis.
Yeah,
I'm like, I'm not sure how much like useful kind of predictive power it has, but it seems right to me.
yeah. I guess there's different formulations of it, but I mean, people start with easy to grasp examples like if I use a pen and paper to work out a math problem,
Mm,
it seems like somehow the pen and paper is part of the process by which I'm solving the problem, and it's not entirely separate from my mental activity. And then you can kind of go from there and see how far you can get people to go with what might count as an extended mind, and how far we can extend ourselves into the environment.
yeah. Um, right. Let's. My sorry, my sensor is being a bit of a pain. Sometimes it doesn't like restarting. Um, right. Let's ask a question. While I do this. Um,
Sure.
oh yeah. So kind of continuing on from where we are. Something that uh, I find somewhat concerning is both um, the pharmaceutical companies and sort of medical industry generally being incentivized to come up with these. We can all kind of agree that like female hyposexuality disorder or whatever it is probably just a marketing term for drugs that increase libido. Um,
Hmm.
but we also get people kind of faking symptoms and trying to diagnose themselves with things um, because they want access to these drugs.
Hmm.
Um, I'm sure if you go to any university in the Western world, or probably in most parts of the world, you'll find students who probably don't actually have ADHD, but they just want access to methylphenidate or amphetamine or whatever. Um,
Hmm.
and I don't know, it sort of troubles me that people who do genuinely have these disorders kind of get thrown under the bus there. Um, but
Hmm.
also that people are kind of forced into a position of lying to get access to technologies that they think are going to enhance their lives.
There's a lot of different things going on here. One is that I'm not totally up on the recent research, but as far as I understand, the evidence that um, Ritalin for people who don't have ADHD or wouldn't
Mm,
meet the diagnostic criteria for ADHD, it's not clear how much it's actually effective in boosting the kinds of performance that people think
true.
it does. I mean,
Yeah.
it might feel as though it's helpful or they feel a little more able to concentrate, but in terms of measurable outcomes, the data seem to be mixed from what I
Yeah.
recall from that research.
No, you are correct there.
Um,
At least I haven't looked into it in a couple of years, but yeah, that's certainly my recollection as well.
Yeah, and I think actually Andrew Sandberg, whose praises we've been singing, has
Mm,
made this point that sometimes people get very concerned about the technology when what they really are or should be worried about is a background set of norms that really ought to be critiqued. So it might be that if we have an environment where people feel that they need to be staying up through the night and you know getting into some sort of arms race with their classmates to get a certain kind of a grade, to get a certain kind of, I don't know, research fellowship, that maybe what we should be concerned about is not who is or isn't trying to get access to a drug to at least attempt to increase their performance, but maybe we do need to have a wider conversation about what's the point of education and what are the values that we should be inculcating in this kind of environment. And you know, you know, maybe if we could change what we think the goal is, we wouldn't have this arms race, and the only people who would really feel that it was important to them to have access to these drugs would be the ones who are really struggling with concentrating without
mm.
them or whatever it might be. So it's not clear to me what the answer is, but I think there is a risk that if enough people at least feel that these drugs are necessary for them to position themselves within some kind of rat race, then those who don't have access to the drugs will find a pressure to begin using them, and then all of a sudden you get this, everybody's trying to bio enhance themselves so that they can just keep afloat, and that does seem like a kind of system level community action problem
Mm.
that we should be alert to.
And as well as Anders as previously pointed out, um, this is somewhat of a complication between kind of positional goods and absolute goods. If I'm able to write a better essay, then that's really just a positional good. But if that actually translates into real world gains, it's not. And as not Anders, your book points out, uh, there's a tension here between sort of individual liberty to choose what drugs to take and what advantages to seek, and the overall societal good where we're ideally not putting huge pressure on people to use biological interventions to improve their performance.
Mm-hmm. Yeah, somebody whose work I like on this is Christina Gupta, who's a sort of feminist bioethicist, I think at Emory University or Wake Forest now, who says that we just have to remember not to fall into the trap of thinking it's one thing or the other. That either we're trying to address a problem through political means and changing the social structural aspects that we want to criticize, or we're fixing problems with technology. We have to find some way of recognizing that these are interactive systems, and they're what she says they calls them co-constitutive, where interventions at the biological individual level may well help some people function in the broader environment. But so too is it the case that we need to take active steps to try to address the structural problems that may be driving some people to want to turn to biotechnology. And we're just going to have to let it be complicated, and we can't take a dogmatic position in favor of just one approach.
Yeah, that certainly seems sensible to me. Um, yeah, so I guess it's an area that we're probably going to have to face up to over the coming decades as biomedical interventions that can actually offer meaningful enhancements, even if just impositional goods are going to become more common as we develop more hopefully sort of societal acceptance of some of these technologies. And yeah, I just think that trying to eke out some kind of space in between, recreational and medical is going to be pretty critical if we don't want to end up in a nightmarish world where we're being offered pills for every ailment,
Right.
imagined or not.
Yeah.
Um,
By the way, just as a
mm,
as a detail,
sure.
for the MDMA and psilocybin enhanced psychotherapy models that are now being tried out for post traumatic stress disorder, it seems to be the case that people are not then being offered a pill for every ailment because they really are working through the underlying issues. And so you'll find people who were taking a dozen medications to try to treat the symptoms of post traumatic stress disorder, and then they'll have maybe 2 or 3 sessions of psilocybin enhanced psychotherapy, and then they find that they're not dealing with post-traumatic stress disorder anymore, so they go off their other medications. So we always have to think about each kind of chemical intervention, not just is this a drug or not, but what kind of drug is it, what exactly does it do, under which conditions, and whom does it help and whom may it harm. And then some of these drugs may have an effective medicalizing society in that they allow people to go off of medications that are just treating symptoms rather than the disease.
Oh, excuse me, just had to fix these. Um,
Mm-hmm.
so I think we've uh, kind of painted a fairly sort of optimistic picture here,
Mm-hmm.
but it's worth considering the fact that historically some of the or many of the attempts to influence our experience of love, things like chastity belts and cornflakes, have uh, have not a great history. I mean, cornflakes,
Mm-hmm.
not specifically, but some of the things that Mr. Kellogg, I can't remember his first name, um,
John
did
Harvey Kellogg. Yeah,
John Henry Kellogg did, yeah, weren't great um, to fight the scourge of masturbation.
right.
But
For people who don't
sorry,
know, the
no, go
inventor of
ahead.
cornflakes, John Harvey Kellogg, part of why cornflakes taste so bland is that he was part of I think, a Puritan religious group that thought that all sorts of stimulation were uh, morally problematic, but also bad for your health, including masturbation. And so cornflakes was meant to be very simple food that could be easily digested, so you wouldn't even have stimulation as you're going to the bathroom. He was also an advocate of circumcision and other forms of genital interference to try to discourage masturbation. And so that's what that references to, just for people who don't know the history of cornflakes.
Oh, and eugenicist apparently.
Hey, why
Yeah,
not? Add it to the mix. Okay.
yeah. Um, Incidentally, I should perhaps have you on another time if you're up for it to talk about genital integrity, because you
Sure.
write a lot about circumcision, both male and female, and why it's I think fair to say pretty fucking barbaric in general, but why there is a
I
lot
think
of subtlety and complexity to the topic as well.
I think there are strong moral reasons not to interfere with the genitals of a child, surgically or otherwise, unless there's a medical emergency. And I think that's true regardless of their sex or gender. But as you can imagine, in reality, that's a very complicated argument to make because it touches on religious
Of
sensitivities
course,
and
yeah.
cultural relativism and all sorts of things. But sure, I'm happy to
Um,
talk about that
cool.
anytime.
Yeah, let's set that up later. But yeah,
Sure.
sorry. As I was beginning to ask a question, then we got derailed by interesting
Right.
historical trivia, which is the bane of my life. I love diving onto Wikipedia and finding out random things. Um,
Right.
but yeah, so there's been quite a few interventions in the past that have gone bad, and I can
Yeah.
certainly say from kind of my field, looking back over the history of brain stimulation, neurosurgeons have done some really bad things to people.
Mhm.
Um, so how do we avoid that in the future, and what kind of big pitfalls should we be looking out for?
Right. So we have a whole chapter which I think is called "Avoiding Disaster," and where I think it's the longest chapter in the book. We're very concerned with the potential misuse of these drugs or other technologies, particularly ways in which they could be used to target vulnerable minority groups, for example, sexual orientation minorities, and that's one of our major concerns. So many people are aware of lots of different attempts to engage in what they call conversion therapy, which is where homosexuality is stigmatized in certain religious communities or many parts of the world for various reasons. There's a pathologization of homosexuality, and then the thought is, well, we should just treat this like we would treat any other kind of problem. And here, how can we use drugs and technologies, and brain stimulation has been tried, and other paradigms to try to fix the problem, quote unquote. And so we're very concerned about this. Um, Broad level response is part of why we're putting this book out there is to alert people both to the potential positive uses of these technologies and to put on the agenda a very serious public conversation about the ways in which they could be misused so that certain kinds of policies and regulations could be put in place to try to prohibit their misuse. So we focus perhaps boringly on a paradigm that emphasizes voluntariness. So as a level one kind of a thing, we suggest that these technologies should not be used on children who, on some views, can't consent to them. Certainly not in the realm of trying to influence their sexualities. It gets very complicated though when you talk about adults. So, imagine somebody who we consider to be competent in society, generally speaking, to make certain kinds of decisions for themselves. Let's say that we would say if they wanted to undergo a cosmetic surgery or something like that, we might think that they are making that decision on behalf of problematic norms that are overly restrictive about aesthetics or something like that. But generally speaking, we think that in a liberal democracy anyway, if somebody is considered competent to make decisions, we should respect their choices about how they use technologies to influence themselves. Certainly, this is true in the case of gender affirmation surgeries. We say, well, I don't know, maybe this is partly to do with stigma and certain kinds of things, and it's not clear that this is ideal that so many people should feel that they need to turn to technologies to change these aspects of themselves. But nevertheless, if that's what they feel is best for them, it starts to get very tricky when you imagine somebody who says, "Listen, I'm a member of a religious community. I've heard all of your arguments, but the truth is, I just think that my relationship with God would be improved if I didn't have same-sex sexual desire." Now, what do you say in a case like this? I actually find this very troubling. As a good progressive, I would say, well, obviously the thing to do is to say that, the person needs to leave their religious community. I mean, get rid of those pesky religious beliefs and just recognize that their sexual orientation is something that ought to be preserved and respected. And the whole point is to change society and not change their sexual orientation.
But of course, the
And so
real
we
world
bring up
isn't quite that simple.
well, exactly. And so, just to use a real life example, we talk about these yeshiva students in these ultra Orthodox communities, I think in Israel
Mm.
primarily, where the students will have same sex attraction or even just a desire to masturbate, which is normatively forbidden in this very conservative community. And so they'll go to the rabbi, and the rabbi will say, well, go talk to the psychiatrist who will prescribe you SSRIs, selective serotonin reuptake inhibitors, which will have two effects. One, the hope is it will treat the depression. These students really are depressed. They have all these desires that are normatively forbidden in their community. So they're afraid that they're, failing on theological grounds and disappointing their fellow community members and so forth. So it'll hopefully treat the depression. And also, they expect that the side effect of lowering their libido will also make it the case that they don't have these desires. Now, it's not reorienting their sexual desires in the case of, say, same-sex attraction, but it is just blocking their libido altogether. And, again, I think the long-term political project for people who are committed to progressive principles about there's nothing wrong with having same-sex desires is to try to figure out how do we deal with things like religious fundamentalism in society, and how do you convince other people that there's nothing wrong with having same-sex sexual attractions, and what is the appropriate use of the law in forbidding certain kinds of interventions. Should these yeshiva students not be allowed to be prescribed SSRIs, given that we know that they're being used with the intention of bringing about a decrease in libido because of the norms that we might object to in this community? Um, I, it's very complicated. Assuming that these are adults, I think there's a real tension here between the thought that you should respect people's decisions about how to intervene in their own uh, selves, and also their sense of what's important for their identity. Um, it might well be that a person's felt relationship to a deity is more central to their kind of Quinean web of self components than their sexual desires. It's
Mm.
possible. Now, again, that might be a problematic effect of growing up in a repressive religious regime or something like that, and we should be contesting those norms, and I think we should be. But anyway, society's going to have to figure this out about when do we say to somebody who doesn't share our value system that they and they alone ought to be prohibited from certain kinds of uses of technology on themselves if they're an adult. Again, we prohibit any such thing for children based on the ethical framework that we propose. And we argue that we should contest any kind of oppressive norms that might inspire someone to want to change their sexuality. But we call for a more nuanced conversation where we are going to have to deal with these kinds of difficulties, and we can't just use cliches and wave the problem away. There's going to have to be a serious conversation about like political theory and how do you advocate for change in values when not everybody is going to agree with those values, and they might be coming from a very different meta-ethical starting point.
Yeah, and Neon Golden in chat brings up less extreme example of this being someone wanting to be less distracted by relationships, dating, crushes, etc., wanting to
Mm-hmm.
suppress those feelings. Which,
Right.
as right-minded progressive liberals, we might say, okay, you can do that on an individual basis, that's fine. But the broader impacts on society, if we're all, chemically foregoing relationships in order to study for the bar exam or the MCAT or the whatever, um, could potentially be be quite concerning. Um, I think
Mm-hmm.
this is particularly the kind of religious example of I think you refer to it as high tech um, sexuality alteration. I can't remember exactly how you phrase it.
We call it high-tech conversion therapy as
High
a
tech conversion.
hypothetical entity that doesn't exist currently. But just let me put it in context. A lot
Sure,
of
please.
people who argue against what they call sexual orientation change efforts, so
Mm,
SOCE, you probably saw in the chapter as well, they say, well, they shouldn't be allowed because they're harmful and ineffective. They don't work and they cause harm. And our argument is that this is not a very principled reason to object to such efforts, because suppose somebody comes up with some technology that's less harmful and is effective, so that now we have what we call high-tech conversion therapy, where it is possible to change your sexual orientation. Well, if the reason why we think that sexual orientation minorities deserve certain kinds of moral and political and civil rights is because they can't change their sexual orientation, that then we're going to lose that argument as soon as technology changes the facts on the ground. And second of all, it seems like it's conceding too much. It's sort of like, if they could change their sexual orientation, then they would, but they can't. So we should be respectful of their orientation. It seems like it would be better to say there's nothing wrong with having the sexual orientation that they have, and it would be unjust even if they could change their sexual orientation to discriminate against them on those grounds. And we already have a model for that in the case of religious affiliation. You can't discriminate against people on the basis of their religious commitments, even though you can change those. I was raised in a religious family and I no longer have that affiliation, but you shouldn't have been able to discriminate against me on the basis of my religious commitments when I was affiliated with that group. So we need to be clear about what we think the underlying principles are here, and we shouldn't say that the reason why we should be respectful toward people who have sexual orientation, who have a minority sexual orientation, is because it can't be changed. One, because technology might change that, and two, it's just the wrong reason to say that people should not be discriminated against.
Yeah, I think that's a very strong argument, and it's something that has long concerned me about this kind of this justification for gay rights being, I was born this way. It doesn't matter, it doesn't
Yeah.
matter if you chose to be gay last Tuesday or you've been gay since you were in the womb. Um, the key point is that there's nothing wrong with homosexual behaviour. We shouldn't discriminate. But yes, thank you for the context, and I think that that helps explain why um, this might be an area where the concept of differential technological development is particularly relevant. So rather than taking a kind of pure precautionary principle approach of trying to all out ban any technological development that could alter sexuality, um, we try to accelerate the development of technologies that might improve our ability to make decisions in an informed and reasoned manner, and try to slow or disincentivize the kind of high-tech conversion therapies that, though they could have some positive aspects, I'm sure it would be nice if we're all living in the world of the culture novels where we're past the need for government or shame or anything like that, and we can just flip a switch any day to change who we're attracted to. Um, but we don't live there now, so we should probably try to kind of rein in that area of
Right.
development until we're a bit more responsible as a species.
Some very good work on that has been done by Candice Delmas and Sean Oz. They wrote a paper responding to some earlier work that I did with Julian and Anders called Sexual Reorientation in Ideal and Non-Ideal Theory. And their argument is that if these technologies were available, they might well be on an individual level basis advantageous for certain people, even just as a way of alleviating the suffering of the prejudice they might be experiencing in an insular community.
Mm.
And so it might be that on a kind of if a doctor were, as it were, prescribing this technology, they would have an obligation to do so out of the motivation of beneficence. But they say precisely because we live in a homophobic world where we have a non-ideal society that we have to contest with, they think we have very strong reason to try to um, prohibit the development of this technology. We should do what we can to make sure it isn't created, because if it were created, it might be that it would be permissible or even obligatory to give it to certain people if it would sufficiently relieve their suffering, even if the suffering was due solely to unjust.
On the one hand, we could, use technologies or cures or so forth to make us more able to kind of interact with society. But on the other hand, a lot of the challenges of autistic people are as a result of the way that society is set up. Um,
Right.
and
And by having certain technologies available, you would actively disincentivize the social changes that would actually create a more just situation for
yeah,
everyone. So it's not just there's well, you could have some technologies available and you could work on changing society. There are situations where if the technology is available, it actively undermines the project, the social and political project of changing society in a way to make it more just for everyone.
oh, is oh bugger, Twitch is sorry, let me just reset what's going wrong. Twitch has been having some network errors. Let me see if I can just. Oh, come along now. Let's see if we can get. Oh, I'm back apparently.
All right.
Let me just. Sorry. Right. Yes. Okay. So we're still going. Sorry about that, everyone. Apparently Twitch has been having some problems today. So sorry. As you were saying, Brian,
Oh, I don't know. What was I saying?
about
Just that
yeah.
yeah, technologies can sometimes, if they are available, disincentivize the social and political changes that need to be made. And I often think of this phrase by Barbara Wuchen from the 1960s, where she said, "Always it's easier to put up a clinic than to pull down a slum." And her argument is that when you have the clinic available and you can just treat the symptoms of the disease, as it were, in this case, the social disease of poverty and lack of equal access to resources, you might just you might not be only alleviating certain kinds of suffering in the here and now, but making it harder to change the political pull the political levers that are required to change the social context.
Mm. And yeah, I mean, it's not a discussion that I have an easy, coming down on one side on. I think it's probably something we need to evaluate in each specific instance. In terms of autistic therapies, there's certainly, um, if I could take a gene therapy that would switch off some of my, particularly the kind of sensory symptoms, I
Mm-hmm.
certainly would. Um, but it does give me some concern to think, if we had some genetic treatment that just completely removed the propensity towards autism, that could have some. Well, I would have never been born, which
Right.
we can argue about population ethics whether that's a good thing or not. But um,
Yeah.
the
Wheel and David Benatar here, and
exactly.
yeah.
Um, but putting that aside, I think there are some genuine concerns about wiping out whole sections of human experience, um,
Absolutely.
in the name of improving welfare.
Yep.
Um, right. So, uh, chat. If anybody's got questions for Brian, please do bring them up. Similar arguments around euthanasia for chronic depression. Uh, yeah, it might be I mean, certainly an effective treatment, but it's not necessarily the uh, flourishing state that we would like to restore. Um,
Mm-hmm.
uh, yeah, I've got the sexual orientation in ideal and non-ideal therapy paper up here. This looks rather interesting. Um,
Really worth reading. Yeah. Although I
um,
want to say, actually, maybe I can put this on record.
mm,
Candice Delmas and Shahnaz, whom I really like and consider colleagues, sort of misrepresent our paper to which they're responding that we wrote back in 2014. They say that, Earp and colleagues suggest that there there is not any need for alarm in thinking about the use of these technologies, and that isn't what we said. We said um, the possibility that these technologies might be developed does not necessarily mean that we need to have cause for alarm because, for example, we might be able to try to head off their development, or we might be able to put certain kinds of restrictions in place so that they aren't used in certain cases. So it's not that we think it's no big deal that there might be high-tech conversion therapy available and that, don't worry, people can just use it autonomously. That isn't what we argue. We suggest that the possibility it might be developed uh, is not necessarily cause for alarm if we want to head off the development, for example. So that's just something I'm glad I can put out here on the record.
well, you're very welcome to use my show anytime to set the record straight.
Right, good.
Um, So yeah, Stanley Cake Lie says excited to see the transhumanist conversation continue. Absolutely, I'm very dedicated to bringing on interesting people with kind of not necessarily just transhumanist views, but views that intersect with that kind of space. And
Hmm.
yeah, so I think that's kind of the main topics I wanted to chat about. Um, oh, one question I did have. So
Hmm.
it is a little bit weird hearing your voice not in 1.5 to 2 times speed, because I listened to the audiobook. And
Right.
how was it recording an audiobook?
Thanks for asking. I recorded it very slowly, and I am glad you listened to it on a little bit of a faster track. I it was good. So I used to have an acting career, and I got some instructions from the folks who were leading the recording session to make sure not to get too dramatic. This is just an academic book, and it should be read in a certain kind of a way. And I think I took them too seriously in that the first two chapters, I think I sound a little bit robotic. I'm just very kind of carefully and not inflecting too much. And by around the second or third chapter, I think I ease into it a little bit more. And so, if you're listening to the audiobook and you're just bored out of your mind, first put it up to 1.25 speed and get at least to the second chapter, and hopefully you'll find that it's a little more engaging.
Yeah, I'm used to listening at a very high speed, so like I did slow it down to 1.5 a bit to kind of luxuriate, but I normally go up to kind of two times or so. Um,
Yeah.
so Stanley K. Cly says, don't see autism as something we want to get rid of, maybe even want to create more high functioning autistic people. Yeah, I mean, one could certainly, given the overrepresentation of autistic people in science and technology, there's the classic SMBC comic where Zach Wiener-Smith argues that uh, autism causes vaccines because of the overrepresentation of autistic people in science, leads to scientific developments, which, there's probably a bit of truth to that.
Right. That's nice. I hadn't seen that one.
Um, and yes, sorry, Stanley Cake, I did start the stream early today, uh, but fortunately you can go back. We're just wrapping up now, so you can go back and listen to the whole thing. And yeah, I would encourage you to do so because this has been a very interesting discussion. Neon Golden asks, does the book touch on helping people with poor experience of dating, e.g., incels as an extreme example, or ethical issues around use by like pickup artist types?
Yeah, well, so we do talk about the impermissibility of, for example, dropping a drug into somebody's drink, and the ways in which these technologies can be misused. And I can imagine a pickup artist wanting to somehow, I don't
Mm,
know, cast a chemical spell on someone to make them like them. And we suggest that all of this needs to be voluntary, above board, informed consent, and so forth. And we try to head off such misuses. Um, in terms of people who may have certain kinds of difficulties in their relationships, we do talk about that. So some people say, to use the example of oxytocin, which we didn't talk about too much, and there's a long conversation to be had
mm,
about that. A lot of those results don't seem to replicate. But assume that you could, use oxytocin as a way of fostering a kind of attachment with your partner. Somebody would say, why not just use, sex and touch and the normal ways that we can get our brains to release oxytocin? Why would we want to spray it up our noses? And we say, well, some people struggle with touch. Some people have had traumatic experiences where it's maybe hard for them to engage in certain kinds of intimacy with their partner. And it might well be that having a chemical aid could allow people to get over an initial hump and to form, greater comfort, foster greater comfort with their partner. And so, yeah, we don't want to have just this one model where we assume that everybody's are these, I don't know, Kantian autonomous agents, just like forming loving relationships. A lot of people have, great difficulties that they have to overcome, or, past experiences which can impair certain kinds of decision making, and then it gets complicated. And we try to keep things complicated and talk about how decision making happens under real world conditions rather than just in an abstract model.
yeah, and yeah, I would certainly support that by saying it's those issues are touched on very responsibly, and uh, if anything, I'd say the main criticism I had throughout the book was that the discussion around kind of drug legalization was very very restrained and responsible in the way that ethicists should be, but at the same time I'm a little bit more legalize it all and let them sort it out.
So let me comment on that. So I share your concern. I think that drug legalization is a very important political project, and as I say, I'm working on a statement to that effect right now. The reason why we want to be really careful here is that uh, if a political backlash is triggered such that these drugs that are making their way into medicine now and getting some traction where people from different walks of political life are interested in them, if some of this moves too quickly, or it becomes seen as a recreational drug that's used in this reckless way, and then all of a sudden these things get put on research restriction again, and we have to go another 50 years before people have access to these medications, I think that'd be really bad.
Mm,
And so the reason why we call for being really careful and really leading with the scientific studies, and adopting a kind of medicalized model rather than a free for all, liberty, liberty, liberty for all, start using drugs today, is because we precisely don't want to trigger a
Mm.
kind of a backlash where then these drugs aren't available for anyone, or they are only available underground. We think that would be a bad thing. We'd like to see these drugs become more mainstream.
Yeah, certainly, and I think that's very understandable. It's a similar argument to the one I used regarding why brainjacking and neurosecurity are such a concern. Um, because the potential offered by deep brain stimulation related neuromodulation devices is so great that we don't want to kind of scare people off with with a few bad examples that get blown up in the press. So yeah,
Right.
I think in the context of talking about this kind of new biotechnology, it's the responsible thing to do. And my 16, 17-year-old Ron Paul loving self is just coming through there.
Yeah. Yeah. We live and learn and grow and become
We
more
do
nuanced.
indeed. We do
Yeah.
indeed.
Yeah.
Um, okay, well, we'll sort of wrap it up there. But thank you so much, Brian. This has been lovely. And like I say, anytime you'd like to come on, chat about circumcision, or just shoot the shit about biotech stuff,
Yeah.
you'd be more than
Happy to.
welcome.
Thanks for
So
the invitation. This is really fun. Thanks for your questions. I really love this conversation, and yeah,
thank
I'd
you.
love to come back on anytime.
Wonderful. So besides love drugs, which we've been plugging throughout the whole show with good justification, is there any other stuff you'd like to shout about or make noise about or whatever to my whole five viewers?
If you get the book and you like it, write a review on Amazon. There's only a couple of people
Mm.
who've done so. They've written very nice reviews, but the more of those, the better. So that's my only plug I'll make.
Okay, I will. I'm going to go do that after the stream because I
Thanks.
enjoyed it very much, and
Great.
yeah, I should write more reviews. Not least because it's quite a good like aid memoir of you know. But anyway, uh, so thank you very much again, and yeah, ooh, and as I said earlier, do follow Brian on Twitter because he's a genuinely really good Twitter follow. And oh, sorry, the final thing I meant to say,
Mhm.
uh, I can't find the post now, but you occasionally post little tweets just saying like you're wonderful, have a nice day, and these kind of little pleasant affirmations. I really like that. I really like just these genuine moments of heartfelt niceness among my Twitter feed. So thank you. Please keep it up.
There's a lot of negativity on Twitter, and it's something that could be a useful platform, but a lot of people get so overwhelmed by the toxicity of it, and I feel that myself. So I do try as best as I can to inject, you know, some love into the universe when I can.
Here we go. Wishing love and peace to everyone from this morning. So I think that's a good note to end on. Thanks a lot, Brian, and good luck with the end of your doctorate. I very much empathise that feel, and yeah, have a great afternoon.
No, thanks. Take care.
Bye.
Bye.
Ah, right. That was lovely. Um, yeah, I've that's the first time I think I've actually like directly spoken to Brian. He's we've chatted on like Twitter and so forth quite a bit, but yeah, I really enjoyed that too. He's a fantastic ethicist and very good author. The book is genuinely really good. I wouldn't just say that. If I had lots of problems with it, I would have dug into him a bit, but no, it makes lots of good points and does it very well. So yeah, everyone go read Love Drugs. Um, uh, and yeah, I'm not a great liar. Um, no, whenever Amy asks, if I've eaten something I shouldn't have or whatever, I'm like, no, no. Anyway, right. Thank you very much, everyone, for watching. Sorry it was an hour earlier start. It was easier for Brian. And yeah, but hopefully you can go back and watch the VOD. And if you did miss it, um, yeah. So what have I got coming up? So Friday, I will probably be chatting with Last Username, whom I encountered while chatting on Geek with Glasses stream the other day, and we'll be discussing Yep, there he is in chat. Hey, last username. We'll be discussing. Uh, yeah, sorry, Stanley K. Clyde. Just I probably should have like mentioned it on Twitter more early, but yeah. So last username and I will be discussing my kind of shift away from libertarianism and anarcho-capitalism. Um, why I'm not kind of occupying that ideological space anymore, but also hopefully chatting a bit about our areas of agreement, the topics within libertarianism that I'm still sympathetic to, and who knows, maybe he can win me back to the world of Nozick and David Friedman. Um, so I'm looking forward to that. That's going to be some point, probably after my usual stream time on Friday, and I'll and I'll also be doing my usual gaming stuff and probably making a cocktail. So yeah, uh, I'm open to uh, libertarian ideas still, and as we were discussing, as I was just discussing with Brian, we certainly take some influence from that kind of area of philosophy. But well, tune in on Friday to find out why I don't uh, anymore go in that kind of direction. Um, so uh, excellent. Well, thank you, Stanley Cake Lie, and yeah, oh, excuse me. Ah, right. Okay. I think I'll probably wrap it up there. Not my longest stream, but I am occasionally trying to like go a little bit longer. But I just I get very tired easily. It's a frustrating thing. But yeah, so you enjoy the YouTube video. Um, oh shit, I did watch last night the Destiny Vosh debate with Striker and the other asshole, and like, can't the Nazis find anyone like smarter or more competent? Like, Eric Striker in particular was remarkably weak, and even if you're engaging in that kind of fucking fascist sophistry, can you not put in a bit more effort, do a little bit of research, so you've at least got something that's like superficially plausible to cite? It's just embarrassing. Um, but it's kind of good seeing these assholes get like dunked on thoroughly and uh, roundly. Yeah, the Twitch left is there's some really good people on there. It's nice to see a fair number of people engaging who are actually reasonable. Because Vosh is like he's socialist and whatnot, but he's pretty reasonable. Um, he's willing to be somewhat incrementalist. His economic stuff is like I don't know, but probably not like super harmful. And um, you know, most importantly, he can like actually put together a fucking argument. Um, Obviously, Destiny is very based. Uh, and actually, Amy and I, fiance and I, were discussing this last night. Is that he's very, very good at presenting a like 90% of the social justice argument without the 10% that like completely turns people off. Presenting it in a reasoned way that appeals to gamers, appeals to mostly young men in a way that they like understand and find compelling. And hats off to Destiny, his impact um, on kind of de-radicalizing people who would be at risk of sliding into the kind of alt-right, alt-right, pipeline pipeline is hugely impressive, and he manages to get a lot of the stuff on like uh, consent and responsible relationships very spot on. Like, good on him. Uh, like actually understand correlation, causation, understand. Yeah, exactly. Uh, is I don't know if Vosh and Destiny are on the spectrum, or at least not far along the spectrum. I mean, they both do deep research, but like deep research isn't I mean it's not even that deep. Like I don't want to uh, have a go at them, but like if there was one criticism that Stryker and what's his face uh, had that was legitimate, it's that Vosh and Destiny were pretty much just presenting the abstracts of papers. Now it's better to present the abstract than nothing, but when you can be bowled over by people who are literally just presenting the abstracts of research, it's it's embarrassing. Maybe more people on Twitch should read my and Amy's VOD from last week or the week before. I don't remember when we discussed the how to read a scientific paper, because it's not that difficult to go into the actual paper itself and get some useful information out of there. But yeah, I don't think Destiny's actually autistic. Like I think it gets joked about, but like he doesn't. I mean, I don't want to diagnose or anti-diagnose anyone, remotely, but you know, and yeah, he does present some like quite radical stuff on consent, but does it in the way that that gamers and bros can get on board with. Not that I'm, dragging down gamers and bros. I'm at least a gamer, and well, I don't know, I play games at least. Um, but yeah, it's it is a somewhat concerning thing to me about the standard debate on Twitch and YouTube, given that people don't really uh, delve into the meat of studies. You'll get people citing a whole bunch of abstracts, and you don't need like deep specialist knowledge to be able to get more out of a study. Um, yeah, Destiny supports a sugar tax, which, like, if your only goal is reducing sugar consumption, then yeah, sugar taxes probably have some effect. It seems that it doesn't stick around for as long as we might hope, but there's a bit of reduction of sugar consumption, sure. But I don't think that means it's good, compelling policy. It is at least evidence-based, but evidence-based doesn't necessarily mean good. Good policy should be evidence-based, but not all evidence-based policy is good, because it relies on certain normative assumptions that I think are not particularly compelling. Um, Not least that uh, there's some kind of special distinction between uh, like sodas and artificial sugary drinks versus fruit juices. That just makes no sense. The sugars in fruit juices have basically the identical effects on you physiology as does the sugar in Coca-Cola or whatever. Um, but yeah, no, you're absolutely right there, Stanley Cake-Lie. It's unfortunate that it is radical to do things like have a conversation about consent before you try sleeping with someone. It seems to me this should be a pretty basic thing, pretty basic like tool in our kit of interpersonal relationships. But yeah, and you see it in chat every time. You'll get people going, interrupting to have a conversation. This is going to completely ruin the mood. Having slept with many women who definitely all exist, I would know this well. I don't want to like shit on virgins. That's mean, but like just have a conversation, have an open discussion, be honest about what you want, and relationships will go a lot easier. And it doesn't mean they're going to go perfect by any means, but this all seems like pretty straightforward stuff. Um, and yeah, he pushed back on that pretty hard. He was like, "Fucking what? How did that kill the vibe?" And he's right. Like if you're having a good time with someone, you're having you're moving towards the possibility of sex, just like interrupting conversation a little bit and saying, "Hey, if you're interested in sex, I'd be up for that. What sort of things are you into? Do you have any limits? Just asking a few of these questions. If they recoil from that, then they probably weren't wanting to have sex with you in the first place. So, you know, oh well, you've missed out on nothing. If anything, you've gained because now an hour earlier or whatever than you would have otherwise known that that person isn't interested in sex with you. So if your goal for the evening is just to find someone in a club to have sex with, great, you've wasted less time. And if your goal is to like have a pleasant evening and have enjoyable sexual encounter, discussing beforehand what you expect, what you hope for, what your interests are, it, in my non-universal experience, it makes the whole encounter go much more pleasantly because you don't have to stop midway through the actual act of sex as much to be going like, oh, do you like this? Do you want to do this? Are you alright with that? If anything, having an open conversation about what you're interested in beforehand reduces the risk of a mood killing intervention, a mood killing interruption in the middle of your sweet, sweet lovemaking. So, it seems like a no-brainer. Oh, hey, Geek with Glasses, how's it going? Um, I feel like we need a new concept of masculinity where you should be a man enough to risk rejection because that takes balls. Yeah, like, and also to not get super offended by rejection. Like, there's when someone says they don't want to sleep with you, that's not a deep commentary on your like social value. It just means they don't feel like having sex with you, which is fine. Like there's lots of people who I don't feel like having sex with, and that's not like a personal insult on their character. Um, but there seems to be a lot of people who treat it as who treat a I'm not particularly interested, a no response as some kind of challenge to be overcome, and that's deeply concerning. Um, yeah, we do need a whole load of new concepts from earlier discussion. We need new concept of medicalization of drugs. We need a whole bunch of new concepts in sexual politics. It's it's an exciting time to be alive, at least, where we're needing so many new concepts and making at least some effort to think of them and engage with them. Um, if for all of the complaining, and there is a lot of complaining to be done about the state of the world and the state of sexual politics and race and gender and all of these big social issues, at least things have come on quite a long way. It's easy to forget, how much progress we've made, but over the last 20, 30 years, the developments in all kinds of areas of social uh, uh, advancement have taken place at a very rapid pace. The the level of like casually acceptable sexism. I remember when I was in school, sexism, homophobia, uh, these were like very commonplace. Calling people the F word was completely normalized. It was. I wasn't in a great school, but it was pretty much inconceivable that one would have come out in school in like high school equivalent. Um, but today that's not at all outside the norm, at least in relatively like enlightened areas. You might still have a lot of trouble in the south, in like the rural areas of the US, but More widely in like polite society, coming out as a teenager is totally something you can do, and then getting married to someone of the same sex is now something you can do. And it's not that long ago that that wasn't the case. Um, yeah, so I worry about certain concepts of masculinity being critiqued without people replacing them as an attractive alternative. I think that's an interesting point, Stanley Kekulai. I think it's something that I think when discussing religion we miss a lot as well. Like the idea of um, just getting rid of religion, becoming atheist as I am, without any kind of replacement support structure is perhaps a worse one than I used to think. And similarly with masculinity, these are memes, these are like societal structures that probably serve some kind of role, probably serve several roles, and trying to replace them without any kind of, or trying to remove them without any replacement in mind is probably a bad idea. Um, but I think one can create positive instantiations of masculinity. I mean, like in a very kind of basic, like consumer, corporate manner. There's that Gillette advert that all of the alt-right people got super triggered over. Um, that was, showing men like just being decent and like stopping each other from like being horrible people and stuff. And that kind of, emphasizing the like the responsibility and uh, the like uh, using one's power well, because obviously, men in society um, are generally speaking have more power on average, like being responsible stewards of that power and passing it on to, not being afraid to like give it up, and not being threatened by people coming in and demanding some slice of the pie, seems like the kind of norms that maybe we should be fostering. Though I don't know, I haven't thought a lot about kind of masculinity as a concept in and of itself. Um, but yeah, it's certainly they do. It's weird that the alt right kind of tries so hard to take ownership over the concept of masculinity, and over the idea of being manly and tough and all of these things, given that like so many of them are these kind of stereotypical basement dwelling dweebs, which I say as if I'd ever had a basement growing up, I certainly would have had my room down there. I'm one of those basement dwelling dweebs, but I'm not the one like claiming to be some hyper masculine, Chad who's stomping over all of the, lib cucks or whatever. The, the fact that they paint themselves as being this, the heirs to manliness and whatnot is just, I don't know, it's fucking baffling. Um, but yeah, there is. Uh, um, there's some good points here though. Neon Golden. So enforcing the weakened sexist ideas is definitely a risk. Like I think there's probably ways of setting up masculinity, one's conception of masculinity, so that it doesn't necessarily enforce those kind of ideas, but does seem like a challenging thing to do. Um, Certainly, generally in my personal life, I'm not particularly interested in defining things in terms of um, uh, the terms of masculinity. So my econ teacher would say marginal improvement is the only kind. Yeah. Well, it's so on the one hand, yes, but on the other hand, some marginal improvements can lead you down an unrecoverable path. So this is something I was chatting about with Brian earlier, uh, is that sometimes implementing a treatment that is positive in the short term may have worse longer term effects. So we might uh, hypothesize in this instance that um, that strongly embedding new forms of masculinity, new norms, could be better than the current forms of masculinity, but would be harder to shift in the long term. So if we just stuck with the current forms, we might be able to kind of get rid of them altogether. But there's less impetus to get rid of these like weaker forms. Um, so it depends on how we actually do it, and I don't have any great insight. Um, but yeah, it's the idea of that ideally we wouldn't need to live up to the ideals of masculinity or femininity, just live our lives. I I would certainly agree with that. Uh, like ideally, I would like to see gender abolished and so forth. Um, in practice, like it's not something that we can make the transition to tomorrow. So I guess the question is, how do we get from here to there, whether getting rid of masculinity or the idea of sexuality or any of these kind of uh, social norms that have some value but also a lot of problems. How do we get rid of them incrementally without causing even worse problems? Um, I don't think that Gillette ad was terrible. It was very cliche, but um, eh, I think a lot of those problems were, if not specific to men, then were more predominant in men, and are the sort of things that it's reasonable to criticize men for. Like, so there's obviously um, the one that particularly springs to mind, uh, or the two that particularly spring to mind, are the dude who like tries to follow after the girl and like wolf whistle her, and his buddy who's like, "Hey man, that's not cool." That's a good thing that men should be doing, stopping each other, like going around harassing women in the street. That seems like a positive behavior to reinforce, and it's certainly true that men disproportionately, at least I don't know about worldwide, I would suspect worldwide, but in the US and UK, it's certainly true that men disproportionately uh, randomly harass women in the streets than the other way around. Like that seems pretty difficult to deny. So while it might not be exclusive to men, I think it's reasonable to point that out as a particular concern that's peculiar to men, or at least disproportionately present in men. And the other one was the bit where uh, the two kids are fighting, and a bunch of guys are like, "Oh, boys will be boys," and like, yeah, that seems pretty reasonable to me. Like criticizing that is uh, like we're talking about the normalization of violence at a young age. I think particularly if we're going from a kind of non-aggression principle perspective, it's probably good to teach kids at a young age that they shouldn't be punching each other and fighting. And the fact that it's normalized with this kind of, oh, boys will be boys, is essentially saying, arguably quite sexistly saying, that boys, we should tolerate bad behavior on the point of boys, we should tolerate assaults on the part of boys because they're somehow constitutionally disposed towards it. They're inherently going to punch each other, so we should just tolerate that, which I don't think is a good norm. Um, uh, yeah, I mean, like I think the guy was supposed to be preying on the woman, or at least supposed to be harassing her. But like just saying hi and asking for people's email in the street seems pretty weird as well. I mean, maybe it's like that we all hate each other in Britain or something, but um, if someone said hi to me in the street and I didn't know them and asked them for my email, I'd probably be like, um, who's asking? What? And and I'm a dude. I uh, I don't get that nearly as much as women do, who tend to um, have a lot of people asking them, and a lot of people who will get angry when they decline. Because it's not just about the dude like following the woman saying, "Hi, can I have your email?" "Oh, you're not interested. Okay." Is the fact that a lot of men will follow the woman, say, "Hi, can I have your email?" "Oh no, oh, just give me the email. Go on, just the email. Oh, it's fine. I'm not going to send you spam." Ha 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 ha. And we'll just keep on like debating the woman until she kind of gives in, and then we'll complain that the woman has given them a fake email or whatever. Okay, let's. I guess this is a link to the advert. I'll switch these back around. Now I'm over here. Let's see. Ooh, look at that ratio. Some triggering taking place there. Right. Why are you taking so goddamn long to load?
To act the right way. Bro, not cool, not cool. Some already are.
Yeah, I mean, like, obviously it's only a couple of seconds, but the dude's like,
Already are.
oh, no, come on.
Thing. To act the right way. Bro, not cool.
The dude's like, oh, you know what he's about to. You know what he's about to do. Come on, he's about to. At least the strong implication there, based on the way that men tend to behave, or at least a lot of men tend to behave, is that he's about to be like, whoa, how's it going? How you doing? You know, like maybe we didn't see the next bit where he definitely went up and started harassing her, but like when a guy goes whoa, he's not about to say anything like responsible. Yeah, just like wandering up to women in the street, like it it would be fine if we were living in this like post-masculinity society that we're talking about, where like guys don't randomly go around harassing women, and if it were just like guy walks up to woman, "Hello, I find you attractive. Would you like to get a drink and discuss this more?" "Oh no, okay, have a nice day." Like if it was always like that, then yeah, okay, sure. But in practice, there's women walking around. A lot of women, if you ask like any woman in Western society, again, like I don't know about other societies, I'd suspect so though, how they get interacted with on a day-to-day basis in the streets. They're not going to say, well, men occasionally come up to me, ask me politely if I would like to go out for dinner. I say no or yes, and they accept my decision. In practice, it's like guy goes up and is like, "Hey, let's go for a drink. You're really hot." The woman's like, "Oh, I'm a little bit busy." "Oh, go on. Just give me your number. I'll call you later." And just like keeps on pressing it. So you can kind of understand, or at least I find it reasonably innocent to understand why women would tend to not want guys coming up to them in the street and randomly ask them out, even if the guy is genuinely, has good intentions at heart. Um, okay, I mean, I don't know where you're from, last username. I would be interested to hear uh, uh, you know the take of women in your area on that. But yeah, if you are polite about it, then sure, it can go fine. And certainly I've had like random people come up to me occasionally, and who've been polite, and we've had nice conversations, and I've encountered people on the street. But the politeness, um, that didn't seem like a very like polite start to a an encounter.
To act the right way. Bro,
when I like if I go whoa and I'm like staring at someone's ass, it's not usually the precursor to my being like, hello, would you care to join me for a drink later, perhaps? No pressure, of course. Um, okay, yeah, maybe they could have easily shown that, but bear in mind it's a, sub 2 minute advert where they're trying to get in like many scenes, and I think the implication is pretty clear. Um, um, yeah, I mean, I personally would be somewhat uncomfortable about someone like following me for a few steps and like tapping me on the shoulder and being like, "Hi, you're really hot." Um, or even if they're being polite about it, it would tend to be a bit unnerving. And there definitely seems to be a greater reason for women to have that kind of concern. Um, but yeah, personally, I don't see any problem with the this advert. It's a little bit like schmaltzy and corporate or whatever, but like I think it makes some pretty reasonable criticisms pretty mildly. And also, uh, if we're not going to take the implication there as read, like all of the criticisms of men in this advert are implicit. I think it's reasonable to. I accept that there are criticisms of men in this advert, um, but I think it's reasonable if we're going to accept that to also accept that the implicit bad behaviour here
Some.
is is fairly clear. Um, yeah, yeah, I think that's a fair perspective for Neon Golden. Um, and yeah, I mean my view of dating and hitting on people is just keep it on the internet. You know, keep it on sites where people have like specifically signed up to receive messages asking them to date, and that seems like the most straightforward solution. But I offer that slightly in jest because it's my preferred way of doing it. But I understand that many people actually want to meet in person. Um, want the ad to be reasonable, so he's going to be rude. People who want the ad to be unreasonable imagine he was going to be polite. If the ad was ambiguous. Uh, I mean, I imagine. I don't think that really follows because I think there's a pretty strong implication there from
Already
the guy's body language, from the fact that he goes whoa. He's not like, oh, she looks nice. It's a whoa. The fact that he appears to be staring at her ass, the fact that like his buddy stops him, so presumably his buddy in this instance has some kind of understanding of his friend's history with going whoa and staring at people's asses. Um, so like yeah, okay, if it were ideally making this point, it would have perhaps laboured it a bit more. And like I'm not trying to defend this ad as being like a perfect representation of masculinity, but I think it's providing a substantially more. He says it to himself. Okay, come on. If you're going whoa as a precursor to, I mean, we're like overanalyzing this to death, but people do have rude thoughts, and that's fine. But when you're about to put those rude thoughts into practice by like walking up behind a woman and making some comment that is you know about to be bad enough that your body's like, come on, come on, Steve, we know what you're about to do.
To act
Yeah, we can
the
certainly
right
agree that the
way.
ad is cheesy. Look at it, look at it. He knows Steve is going to do something ill-advised. You know, I mean, the most impressive thing about the ad is the fact that it managed to potentially somewhat cynically present this very debatable um, instance, so that we're watching over and over an ad from a year ago, a year and a half ago, and providing it yet another view of the 35 million views. I mean, yeah, Steve's not bad. Um, he's a bit like muscle dude for my taste, but yeah, yeah, yeah. Oh, Steve's at the bar. Could have a fun evening, no doubt. But Steve just needs to chill out a little bit. Um, and yeah, I think this is a fair point. So Neon Golden's saying that following me home, cornering me in bus stops, threatening me when I decline a kiss from them, making explicit sexual comments out of nowhere. Um, these are these are the kind of things that I've heard from quite a lot of women as being the kind of default street interaction with men. Um, so maybe the ad could have done a better kind of representation of that, but yeah, I think as kind of corporate propaganda goes, it's pretty responsible. Um, uh, you honestly can't imagine a young and inexperienced man interpreting this ad as saying a socially unacceptable approach to women you don't know, regardless of how you behave. Maybe they could interpret it that way. I can certainly imagine that, and like I say, I'm not like presenting this as the ideal description of masculinity, but honestly, I think uh, it being socially unacceptable to approach women you don't know, if their ability to grasp social norms is so limited that that's their only like takeaway um, from the combination of this and the broader socialization, then maybe they're the kind of person who shouldn't be approaching women they don't know in public. Like, I don't think it's necessarily such a bad thing if some guys just don't like approach women and weird them out. Um, stick to discussing online where it's easier for people to exit. And oh yeah, we absolutely learn social norms from watching TV. I learned a lot of social norms from like I said earlier, I'm autistic, and a lot of my like social scripts are built up from TV shows that make it easier and straightforward to like interact with people. So yeah, we absolutely do. My point was more that if his takeaway here is the very unnuanced point that it's entirely socially unacceptable to speak to women you don't know in any circumstances, then if they're so bad at interpreting social norms from TV and from broader society, then they may well be the kind of person who probably shouldn't be going up to people randomly, at least while they still have that kind of limited understanding of the circumstances where it's okay to approach people. Because like there are ways of approaching strangers in public and making one's attraction known. It's just that they tend to not involve just like walking up to people on the streets. It's at a bar when the person is receptive to that kind of thing, and deciding when that is. I know from personal experience I have a lot of difficulty with that. It's not an easy task if you're not hyper socially competent. So I'm not like intending to drag on young people who uh, take out the message that just don't like go up to people in the street. But it's not women's job to tolerate uh, unwanted social encounters every day, all day, from guys who haven't learned like adequate social functioning. Um, I include myself in that. I was, in my teens, I was hardly like the most tactful, responsible person. I'm sure I had lots of cringeworthy encounters that, the women involved would have been, or girls or whatever involved would have been, completely justified in just ignoring me. Um, so confusing messaging about social norms and likely to create more people who. I mean, this is, if you're taking all of your messages about social norms from like one Gillette advert, then there's a problem. Um, I don't think adding a little bit of nuance to, you know, don't randomly harass people in the street. If you want to, speak with people you don't know, engage in that meeting in a more responsible manner. I don't think that's a hugely confusing message. Um, Certainly not any more confusing than a lot of the prescriptions of like traditional masculinity, where you have to be a caring provider for your family, but you also have to be emotionally unavailable, and you have to be stoic but also violent when appropriate. That whole mess of demands made by like traditional masculinity is pretty confusing. Certainly, a lot of men seem to have a lot of difficulty with that. So, ideally, we would be able to message all of our social norms very. Uh, okay, this is something I can objectively disagree with. Um, so it's not helping anything. I disagree, but not particularly strongly. Terrible marketing, not for shit. Look at this, 35 million views. And let's see if we can find Gillette sales figures. Uh, uh, 'Cause I'm pretty sure they've uh, here we go. Oh wait, just a sec. Oh, no, apparently Gillette. So whether or not it was um, related to, let's see, right? Let's look at it on this screen. Um, uh, okay, so the sales figures were shit beforehand. Um, what was that? Okay, apparently got a lot of views, but yeah, maybe not such a great. Oh wait. Okay, so this has become um, a whole big argument. Hmm. Okay, apparently I can't claim you're objectively wrong there. My mistake. Uh, yeah, no, that is a bit of a better, bit of a decent point at least. I think that for a staple like this, maybe not such a great. Hmm. Okay, I will take the L on that one because I don't think my claim, my very excited claim of you being objectively wrong was correct there. Fuck off with your goddamn facts. Oh, sales remain unchanged, in line with pre-campaign. Okay, so it was at least very successful in getting millions of views, so that's what it mainly achieved. Um, Right. Um, but yeah, I think certainly on Friday I'll be interested in chatting about this thing that Stanley Cake Lie brings up, libertarianism plus global welfare net. Um, and more generally, I think the role of charity versus kind of government donations. Um, be interesting to discuss. Anyway, I'm kind of rambling now, but no, I certainly take your point, last news name, that it's maybe wasn't great marketing. Um, got a lot of views, but maybe didn't actually sell a lot of shaving products. Nevertheless, I think it's. I personally quite like the rainbow capitalism and equivalent kind of corporate um, uh, corporate like whitewashing of socially acceptable um, causes, because it at least indicates that these things are being more normalized. Another example from the ad: boys are bullies, except girls are even bigger bullies. Well, I mean, the ad is specifically about like men. We're discussing, and boys are much greater physical bullies than uh, girls. Girls may tend towards more like psychological torture of their victims in school or whatever, but um, I where's the bullies bit? Um,
But some is not enough.
It's not how we treat each other, okay?
yeah, I mean like
Because the boys
this
watching today.
this seems like a pretty decent message. Like a lot of boys are bullies and bullying is bad, and in a advert that specifically talks about like problems with men and being a better man, that seems pretty reasonable. Um, uh, I don't know. I think it's no cruder than any number of. It's certainly less crude than some of their historical uh, adverts of jet fighters exploding shaving foam into your face and whatnot. Um, yeah, I mean, I don't have a strong opinion on the relative rates of bullying by the different sexes. I know from my personal experience that I was bullied much more by boys, but my understanding is it tends to be more like intra-sex. Um, so boys bully boys and girls bully girls. That's my vague understanding. Um, but yeah. I think psychological bullying from boys is also underrated. We seem to think guys are just physical and can't engage in complex social behaviors, which is bizarre. Um, yeah, I mean, I again, I can only really speak from personal experience where the physical aspect was more prevalent, but a lot of the people who bullied me were very stupid. Um, one of them's in prison now. Not that, I'm pleased or anything, but I mean, it's a little bit of Schadenfreude there. Actually in prison for quite an unpleasant, like racially motivated attack, the little fucker, which was pretty, pretty predictable based on his behaviour in school. Um, could have taken on the topic of evolving masculine norms so much better. Um, yeah, perhaps. Maybe this is something we should talk about on Friday, last username, because I'd be interested to hear your take on like how we can present these things better. Um, uh, oh wow, did you also have a bully who went to jail, Stanley Cake Liar? Um, not that I'm endorsing the current prison system. I think there's a lot of problems with criminal justice, but uh, that fucker's in prison. Oh, bit childish of me, but Um, anyway, yeah, let's chat about that because I think that'll be we have a lot to talk about, and I'm looking forward to it. Um, but yeah, right, it's getting on a bit. See, I often do this. I like stop the main um, portion of my stream, and then I'm like, right, I'm just going to go now and finish up, and then I'm like an hour later still chatting along. What a dick! Punched you out in a parking lot. Well, fuck that dude. And yeah, I hope that oh, it was different. Different type of football um was the bane of my life. Yeah, soccer. Um, it's a bastard game because whereas with American football, the violence is very obvious. With soccer, it's if you're trying to assault someone else on the pitch, you just kick them a lot, kick at their shins. So I got a lot of shin kicking, and yeah, although I brought a briefcase to school because obviously I did, and one time a bunch of bullies who often kick me and stuff. One of them was pissing me off, and I can't remember exactly what he was doing. But I just like wound up, pulled the briefcase back, and whacked it into his shin, and he couldn't walk for the rest of the day. I I took the Israel school of response of tolerate things for a while, and then something tips you over the edge, and go way too hard. Um, yeah, and it was a one of those big like aluminium briefcases as well. So as I understand it, that was quite painful for him. Um, uh, right, okay. So I'm gonna wrap it up there. But yeah, thank you very much everyone for watching. It's genuinely really lovely that I'm building up a little community here, and that I have lots of regular commenters who are keep coming back, and a few new people and everything. It's really wonderful, and I very much enjoy having these conversations with interesting people, interesting guests, and with all of you. So, yeah, thank you, last username. And thank you, Stanley and Cake Live, continuing to be awesome. And thank you again, J-Tibbs, for subscribing yesterday. Well, Monday. Very much appreciate that. And, oh, thank you. Well, if you want more of me, tune in next time on Post Normal when I'll be making a cocktail and doing some gaming, and then later on in the evening chatting with you. So yeah, um, thank you. Well, thank you. Well, if you like me, tell others, spread it around and whatnot. Uh, that's always appreciated. And yeah, like, comment, subscribe, whatever, so that you'll follow up. Do things that improve my value in the eyes of the reinforcement learning, the machine learning algorithms that govern our fate. So, on that note, thank you very much. Everyone have a pleasant evening, and I will see you on Friday. Well, no, I'll see myself in OBS, but I'll see you in chat. So yeah. All right, lots of love.